All right, thank you everybody for joining us. The time is now 11 a.m. and we are ready to start. So thanks everybody for joining us this morning for our webinar on modern data management for optimizing food and nutrition services presented by our very own Stacy Berta. For our first order of business, let us introduce ourselves. I'm John Blackham. I serve on Ecovia's marketing team, and most of my work is on the back end with lots of the technical writing, the blogs, white papers, data sheets, etc. I've been working for the company since 2017, and our presenter, Stacy, her experience with our ClientTrack platform stretches back to her work with nonprofit human services organizations, where she used the platform as an end user. And since joining Ecovia in 2012, Stacy has served as an account manager, solution engineer, business analyst, implementation engineer, and many more. She wears many hats, and she currently serves on our product team, where she works with all kinds of prospects and existing clients to help scope and define project specifications. She helps demo the ClientTrack product like we're going to be doing later this morning, and she supports product enhancements. And taking a look at our agenda for today, we're going to have a brief little introduction of Ecovia, who we are, what we do. We'll begin our demo where we will talk about health and nutritional assessment, data-driven meal plans, delivery, scheduling, and route optimization, reporting and analytics. And then finally, we will have a question and answer session. And throughout the presentation, you can go ahead and submit questions through the chat, and we'll be gathering your questions to be able to answer them at that point. So let's hop right into a little bit about us, who we are at Ecovia. Yeah, so we just hop to the next slide real quick. Thank you. Yeah, so Ecovia, we are a privately held company based in Salt Lake City, Utah. Our track record stretches back 20 years in case management for health and human services, which includes things like food and nutrition services like we're going to talk about today, but also goes into issues like homelessness, workforce services, and a variety of other human health and human services, other areas in that field. We are positioned at the forefront of the convergence of social services and healthcare as that develops, and we serve currently more than 1,300 clients across the public sector and in nonprofit and for-profit organizations. And with that, I believe we are ready to turn the time over to Stacy and get started with our demo.
Thank you, John. Good morning, everyone, or afternoon, depending on where you are. Our demo today will provide a high-level look at common components leveraged by food and nutrition programs. ClientTrack is a robust web-based case management solution for health and human services designed to break down data silos and drive effective service delivery to clients in need, helping improve the health and well-being of the clients you serve as efficiently as possible. ClientTrack is a modifiable solution using designer tool sets in the system to align the forms and fields with your needs. Everything I demo today is an example based on experiences we've had with many food and nutrition programs. As John mentioned, we work closely with agencies that provide a wide range of services and programs, including those that not only offer food and nutrition, but also other services such as education, workforce, homeless services, healthcare coordination, and so much more. From initial application or referral to intake, assessment, meal scheduling, prep and delivery, ongoing care management, and aftercare, ClientTrack provides robust data solutions for food and nutrition care coordination. When logging into ClientTrack, my dashboard displays critical data relevant to me based on my role. My follow-up tasks list provides a clear view of my priorities and lets me select and update records. In addition, I can see critical data that might be appropriate, such as counts, charts and graphs, and detailed information on the clients I serve. As a dietitian, today I am going to follow up with Shelley as she requires a nutrition assessment. As I access Shelley's record, her dashboard displays the most important information to me as a dietitian. I can see the most relevant information to me, such as diet type, key information on deliveries, that low BMI. I can see that Shelley was previously enrolled in the AA healthcare program, and previously today, the Client Services Department completed an intake into our core frozen foods. That's where they identified the low BMI and a new diagnosis of cancer, driving our need to complete that nutrition assessment. The nutrition assessment uses ClientTrack's workflow designer to streamline data collection in a step-by-step data collection process. Workflow Designer is one of many tools in ClientTrack that allows us to align the steps of the workflow and the data you collect with your needs. Workflows create that easy-to-use data collection to create effective quality data based on your funding requirements or business rules. As I complete the nutritional assessment for Shelley, the workflow includes rules to make sure that I collect the applicable data based on the program or contract she's rolled in, demographics such as that cancer diagnosis, and any other information in the system based on your needs. You can see examples of point-in-time assessments that are commonly collected by similar agencies. Our first example is the BMI, allowing us to review the most recent BMI, update any data, and calculate automatically the BMI score. Other assessments we'll complete include health, dietary, therapy, medication, and nutrition assessments. Assessments often align with research-based assessment requirements and industry standards, such as ICD-10 diagnosis codes, maintained directly within ClientTrack. Drop-down lists and values you see all are modified based on those that are applied at your agency. We can identify and track related to Shelley's most recent cancer. She has been prescribed chemotherapy and is currently undertaking chemo. ClientTrack also maintains RxNorm, a federal data bank of federal medications provided, allowing for search as you type capabilities, easing the burden of reporting on complex and often misspelled medication names. You may collect some or all of these assessments and more. ClientTrack not only includes a wide range of assessments out of the box, but enables efficient configuration within Forms Designer to align the fields and data collected with your needs. Case management features are included as part of this example workflow, allowing me to track things like goals, allowing me to provide for effective care planning and outcome measurements. Referrals provide powerful referral management functionality to track internal, external, and incoming referrals. Streamline referrals by filtering to a list of community providers or internal programs that offer the services the client needs, enabling the provider selection to easily connect the client with the right services within your community or agency. Print vouchers, notify providers based on new emails if appropriate, and track referral outcomes to ensure effective tracking and reporting of those connections. Document narrative details with case notes, allowing for narrative context and documentation sharing across users within the system. Document services provided, allowing you to not only document direct services or time spent in a meaningful way for comprehensive reporting and analysis. Data quality is built directly into the workflow, ensuring data is entered accurately for effective data reporting. ClientTrack enables data-driven meal planning based on program and contract level meals in alignment with client diets and restrictions, so your staff and volunteers have access to know what to prepare, how much to prepare, and when. Whether your programs and services offer a standard meal plan or a variety of meal options, food or grocery pickup or delivery, or any combination, ClientTrack's program settings and meal components are designed to support your operational needs. From ordering to preparing and packing, ClientTrack puts the data in your fingertips so staff and volunteers can serve the clients effectively and accurately. Role-based access ensures users see the right data when they log in, showing the menu options applicable based on user role and client-level information based on defined security rules. Kitchen staff and volunteers can log in and see what they need at their fingertips, such as dashboards, which provide easy access to data, such as counts and tallies, available in real time. This example dashboards includes data for this week and next, allowing us to take a look and manage our workload effectively. You can also see this data in standard report formats, such as our meal counts report, allowing us to quickly pull up and see all the meal enhancements and components based on diet for each delivery date, in this case, for a particular week, this week. access needed lists directly in the system, such as birthday lists or similar lists that kitchen and operational staff may need. Print meal labels that are aligned with your label preferences, whether they're detailed and specific for each individual client being served, as you can see in this example, or more generic labels by route and meal and diet information. ClientTrack reporting and forms allow for exporting to Excel and in formatted reports, PDF and Word as well for effective management of that data. Pickup or delivery scheduling is created and managed related to the client's enrollment, diet, and identified components. You can see here our ability to access our scheduled deliveries with the ability to filter this list by date, program, route, and statuses, effectively managing scheduled deliveries and components. ClientTrack supports address verification and geolocation capabilities that supports features like mapping, along with route and driver management. Integrate directly with route optimization software to feed delivery routes and schedules between ClientTrack and your fleet or route optimization tool. Provide drivers with critical data directly from the system for the day's deliveries to improve accuracy and efficiency, including counts for the route to enable accuracy when loading or preparing for deliveries, counts for each individual delivery, and detailed instructions and appropriate details as appropriate. As you can see, ClientTrack's real-time reporting capabilities provide critical data access directly within ClientTrack. Formatted reports, such as the delivery route sheet we just saw and the service summary report I'm running now, easily allow users to define filters and run the report in real time. Users also have the option to schedule reports, running those on a recurring basis. ClientTrack includes client-level, program-level, service-level formatted reports out of the box and aligns those reports based on your requirements. Ad hoc reporting is performed using ClientTrack's Data Explorer, giving users the ability to drill into critical data without technical knowledge of the SQL relational database structure. ClientTrack provides access to data sets and allows users to select the data they need. Set any filters for the question and see the results directly in the system. Review the data, create visualizations, defining the chart settings as appropriate, and export those charts and the data to use as needed across your agency. Create and save questions, share them across users, for effective reporting access. Data Explorer allows users to define join rules and summarization options within your reporting. My total services per month report provides a count of services by program and service. Data Explorer allows each user role to have access to the data applicable to them for ad hoc querying. You can see here a wide range of data sets accessible to me as a kitchen and operations employee. If you leverage advanced analytics tools for additional analytics, ClientTrack includes services to connect for additional analytics capabilities, allowing you to use a tool such as Power BI or Tableau to connect and perform advanced querying. Providing such a critical service requires a lot of moving parts. ClientTrack helps you manage resources, coordinate efforts, and achieve maximum reach and effectiveness so you can take care of the people you serve to improve health and well-being in the community. That concludes our demonstration, and we'll jump into the Q&A section of our webinar.
Thank you so much, Stacy. Yeah, let's hop into the Q&A, and we've been sort of monitoring for questions. I'll just hop right in with the first one we see here, which we received. Let's see, how does it integrate with third-party? Care to speak to that, Steve?
Absolutely. ClientTrack supports both API or flat file integration methods, such as CSV or XML formats, to integrate with the route optimization tools that you use. We work closely with you and your route optimization vendor to bridge that gap and share the right data between those systems. In addition to route optimization, we have integrated with many other systems, whether it's funder databases, internal systems, community partner databases, to drive collaboration and efficiency in using and access to that data.
Or maybe want to integrate with other groups in our community. Does ClientTrack have other functionalities? Is it able to accommodate for that?
apologize, you cut out for me just a minute, John. Can you repeat the question?
Oh, sorry. So a lot of organizations do things other services or might want to be able to integrate other services or groups, and can ClientTrack do that?
Yes, absolutely. ClientTrack partners with many other database vendors and works to create efficiencies through integration, and can leverage a single database for food and nutrition programs, as well as a wide range of other data across case management within health and human service data sets, providing a collaborative and data-rich environment for client-focused services and support.
So let's go on ahead and yeah, let's conclude here. Let's hop on to the next slide real quick. Apologies, by the way, I'm hearing that my audio might be cutting out. If that's the case, I do apologize. There are some connectivity issues I seem to be having. Real quick, so let's just, it looks like that's the last question that I have. Can we continue on, and then we'll be able to give us a good old conclusion?
We want to thank everyone for joining us today. If you have any more questions or would like any more information, please reach out